I'm George Conway. I'm a physician and epidemiologist, and I serve as the director of Deschutes County Health Services. I'm here today to talk about wildfire smoke and how to protect yourself. It's been a rough year already. There's a pandemic with COVID that already has people worried, and it means that some people may be ill. It means that we also want to be sure that none of us make ourselves more susceptible to this nasty infection. So one way to do that is during a smoke season is avoiding smoke and reducing your exposure to it so that you don't irritate all your mucous membranes and make yourself even more susceptible to COVID. The steps should include looking outside and seeing if it looks smoky. If it does, you can either make a visual judgment based on the visibility. If you can see a long ways, it's probably okay. If you see less than 5 miles, then you need to be cautious and think about whether you have any underlying illnesses or chronic diseases. If you can see less than 3 miles, then be more cautious. If less than 1 mile, probably everybody should be very cautious about going outside. The other thing you can do is you can look there's various websites where you can look at the AQI or Air Quality Index, and dependent upon your own condition, pay attention to the colors and what those indicator colors are. So if it's red, then pretty much everybody should be really careful about going outside. If it's orange, then people that have any sensitivity to irritants, air pollution, or currently ill with a respiratory infection should be cautious. If it's yellow, then everybody should be thoughtful about not exercising too vigorously. If it's green, run outside and play. So the main thing you're trying to do is avoid breathing smoke. And the reason for that is smoke, you can have coarse particles like ash that you might see on your car if there's a bad fire. But the finer particles are called PM2.5, and they're tiny, and they can get inside your lungs and get actually into your blood system. And that's the main thing that we really worry about. So what you want to do is you want to keep the windows closed, windows and doors closed. If you have to go through the door, then just close it behind you. Try to make sure everything is reasonably well sealed. So the main thing is to do that and avoid the infiltration of smoky air. The second thing is if you have an air filter, an electronic air filter, that'd be a good thing to turn on. They work best at higher speed. If you don't have an air filter, but you have a box fan, you can also get just a square filter to affix to your box fan with tape. And that'll do a really good job if the filter is what we call a MERV, M-E-R-V, 13 or higher. These masks, this is what's called commonly a surgical mask or procedure mask, as well as the homemade or commercially made cloth masks, we're using a lot during COVID for the same reason that these medical masks were originally designed. And that was to prevent, if you have a sneeze or a cough, or if you're speaking loudly or singing, prevent your spraying mucus particles that might have viruses on them on other people. On the other hand, if the goal is to protect yourself from inhaling things, then you need actually a special mask that is very good at filtering very small particles and pathogens as well. So people that are working in a high-risk environment for COVID may want to wear what we call an N95 mask, which means it keeps out 95% of those small things. Equally true, if you're going out in heavy smoke, you don't have any underlying illnesses, and you will be doing something that's strenuous, you should wear the same kind of mask, an N95. For more information, we have a lot of information on our website, www.deschutes.org/smoke.